also know that medical institutions and healthcare systems have to be held accountable to our communities, to the folks who come to seek care and their support systems. I also know that abortion bans, restrictive policies that criminalize pregnant people regardless of their choice for how to move through their pregnancies, delay, deny, and distort appropriate, high quality, culturally competent, and dignified care for pregnant people in Georgia. I know that these laws create an environment of fear and attempt to coerce us as providers to align with the state, as opposed to aligning with our primary point of accountability, the patients that we work so hard to serve. I know that medical racism thrives in our healthcare systems and must be eradicated. I know that Black and brown folks, queer and trans folks, and disabled Georgians, are dehumanized within these systems and spaces, and that will no longer be tolerated because we deserve better. It's that simple. Adriana deserved better. Her family deserves better. So I ask that we continue to look forward, continue to be as bold and expansive as possible. Let our grief be the fuel that we need to demand better for ourselves, for our communities, and for our futures. Thank you.
Thank you so much. Next up, we're going to have Enyang Njoku speak from the Access Reproductive Care Southeast Healthline. She is the Director of Caller Services.
Thank you. I just want to start off by saying that Adriana is in my thoughts and prayers, and this whole thing has just been very disheartening. Hello, my name is Enyang, and I'm a registered nurse and the Director of Caller Services at Access Reproductive Care Southeast. ARC Southeast is a reproductive justice organization that funds access to reproductive care, including abortion, and we provide logistical support to Southerners needing care. That means on our health line, we speak with hundreds of Southerners every month after they make their appointments, who often call us at their most desperate moments in need of support. Imagine wanting to terminate a pregnancy that you can't afford and not being able to because you don't have someone to watch your children, gas to get there, or funds to pay for it. And that's where ARC steps in. Some may wonder why an abortion fund is speaking about this situation, and the answer is simple. These legal restrictions cause confusion, leading to the denials and the delay of care for all pregnant people, which can be deadly. We are losing people because of the barriers these laws create, because even when they may not apply, they may still dictate the care we receive. We firmly believe that everyone deserves the right to bodily autonomy and the freedom to make decisions about their own health and future. Tragically, far too many pregnant people in Georgia, like Adriana, have been denied the right to make these deeply personal choices. We also believe that everyone should have unrestricted access to resources and information they need to make informed decisions, which includes the right to have one's pain taken seriously and for compassion to dictate care, not fear of the law. But here in the state, lawmakers have imposed harsh restrictions and regulations under the false belief that they know what's best for us when it comes to reproductive health care. The reality tells a different story. These abortion bans are doing real harm, especially to Black women. In 2024, a large majority of callers who ARC Southeast supported, over 43%, were from Georgia. And so far in 2025, Georgia remains our top state in urgent need. As a nurse, I've seen firsthand how patients coming in for reproductive care are often accessing the healthcare system for the very first time. In many cases, it had been decades since they even had their blood pressure checked. That's how deep the gaps are in the healthcare access in our communities. Restrictions on reproductive care, from abortion and pregnancy to miscarriage and everything in between, don't just limit options, they endanger lives. We all deserve to live in a world where our healthcare needs are met with access and compassion, not judgment, and where no one is ignored. Thank you.
Thank you so much. Next, we're going to hear from Stephanie Aristide, Policy and Advocacy Associate at Black Mamas Matter Alliance.
Thank you, Rula. And I want to share the same condolences that everyone has shared to Adriana and Adriana's family. So we are heartbroken and outraged over what is happening to Adriana Smith at Emory Hospital. Her case is not just a tragedy, it is a glaring example of the obstetric violence and reproductive injustice that Black women and birthing people continue to face within our healthcare system. We know that Adriana deserved so much more than what she is receiving. She deserved quality care, dignity, the right to make decisions about her body and her birth experience. And instead, she is being kept alive to serve as an incubator for a fetus. So we're seeing in real time that her bodily autonomy is completely being disregarded. And so we have to ask, was this part of her birth plan? Did she even get an opportunity to create a pregnancy plan with the care that she wanted? When we speak of birth injustice, this is exactly what we mean. Adriana was not treated as a human being with rights, needs, and desires. The ripple effect of Georgia's current laws that restrict midwifery access and limit reproductive health services has stripped Adriana's ability to curate her own pregnancy experience. And that is reproductive injustice. At BMMA, we always say we are not just doing this work for Black mamas, we are the Black mamas. Adriana was part of this community and this workforce. She was someone we are doing this work for, and we're doing it with her. So we feel this loss deeply. Losing Adriana is not just a personal tragedy, it's a systemic failure. She was a nurse, a care provider, a Black woman dedicated to helping others, a mother, and now she is another name added to the ever-growing list of Black women lost in a system that continues to devalue our lives. And this is why we advocate to reduce maternity care deserts. This is why we work to close the workforce gap. We are losing our Black nurses, midwives, and doulas, people who not only provide the care, but also carry the lived experience and cultural understanding that makes a difference. So when we do the work of Black maternal health, this is the picture that we're painting. This is why our movement, especially led by BMA, is so vital. And so we must continue to demand investment in Black maternal health equity. We need more Black midwives, nurses, and doulas, more providers. We need policies that are clear, concise, and center our autonomy and our lives, not laws that strip us of them. We need systems that honor our birth plans, support our choices, and respect our humanity. So I want those that are working on Adriana's case to ask yourself, is this the quality care that Adriana deserved? System. Is this treatment worth the devastation her family is also going through? So we have to ask these questions because Adriana's life mattered, and so do the lives of every Black mama still fighting to be heard, seen, and cared for. And so we want to continue sharing and amplifying not only the injustices, but solutions to eradicate cases like Adriana. And so we say, if you would like to learn more about our work here at BMMA, we ask you to follow us. And, we have our comprehensive policy agenda with recommendations from those that have been doing the work, our Black midwives, our nurses, our doulas, that have created policy recommendations to create a pathway for policies that not only protect our perinatal, maternal, and reproductive workforce, but our Black mamas. Thank you.
Okay, thank you, Stephanie. Next up, we're going to hear from Ashley Sawyer, Senior Policy Counsel for Pregnancy Justice.
Thank you, Vula. I appreciate you. And just first, thank you to Amplify Georgia and all of the Georgia-based organizations that helped bring together this conversation and the work that's happening already. um, Pregnancy Justice, we're here because we believe that pregnant people are entitled to all of the same legal rights as everyone else, and that a person should not lose their rights because of their pregnancy. And we are unfortunately called to speak up about the tragic loss of life of Adriana Smith and what is probably what is a blatant denial of dignity even in her death, and really the legal landscape of confusion that gets created by Georgia's HB 481 and the dangerous scenario that gets created when lawmakers try to give legal rights to embryos and fetuses while still stripping rights from the mother or the pregnant person. Every family isn't going to have the opportunity to get maybe a clarification from the Attorney General's office. And this legal framework of fetal personhood creates a dangerous precedent where families are forced to weed through legal mazes, providers are forced to weed through legal mazes in order to make healthcare decisions. And I just want to keep emphasizing that people should not lose their rights, their dignity, their humanity, or their legal rights when they become pregnant. And while there's still a lot that maybe is unknown about this case, we do know that Adriana is not the first and unfortunately may not be the last person to suffer this way. Just by way of example, in 2013, there was another Texas woman who had a blood clot in her lung and she was declared brain dead. And in that incident, her husband, who was an EMT, made her wishes clear and said that she had also made her wishes clear through an advance directive. And because Texas had an advance directive act, the hospital refused to honor her legal document or her wishes, and her husband had to go to court. And it took 62 days for a court order for the hospital to remove her body from the machines. And no one should have to live through that kind of indignity. No one's family should have to battle it out in court to honor their loved one's wishes. But this is the legal landscape that we're living in. Texas and Georgia are among the states that override the advance directives of pregnant people. And that means that even if someone has a legal document that clearly expresses their wishes or what their desires are, that person's wishes may not be honored because they're pregnant. And these laws make it so that pregnant women and pregnant people are denied the full legal rights of everyone else. I don't know that we can speak to what Adriana's wishes may or may not have been, but we do know that pregnant people should not face added hurdles to healthcare or have their next of kin suffer through what I'm sure is an excruciating decision-making process, only to possibly be denied the ability to make a choice that is most appropriate for them. That is unjust. The legal framework that gives more legal rights to an embryo or a fetus than to the pregnant person, it paves the way for criminalization and the type of violence that we're here today for. And so I think it's important to connect the dots across the pregnancy criminalization that we're seeing happening all over the states like Georgia that override the wishes and the legal documents of pregnant people, and with the legal landscape that makes the bodies of Black women become sites of legal battles and heartbreaking disrespect in what probably could have been a personal family decision outside of the scrutiny of legislators. We already know here that Black women face an extraordinary risk to their safety and their dignity when they're pregnant in this country. We do know that Adriana is not the only Black person to die during their pregnancy, and this country has a maternal mortality rate that is 2 to 3 times that of every other industrialized nation. There's also data that indicates that Georgia doctors are having to decide whether to delay care for pregnant people because of fear of laws like HB 481. And so that obviously brings to mind people like Amber Thurman and Candy Miller, who should be here with us today. And it breaks my heart to add Adriana to that list. And I just want to close by saying there's so much work ahead of us for those of us who care about reproductive justice and the human rights of pregnant people. And of course, our work right now is to continue to hold Adriana Smith's family and to offer ourselves as organizations that can provide support as they navigate this. but her body belongs to her, and it should never have become the site of a legal fiction or anyone's political battle. And as we continue to hold the grief that many of us hold around Adriana's story, we also have to work to pass the Georgia Reproductive Freedom Act that could repeal the dangerous and confusing statutes like HB 481 and prevent these types of tragedies. I am so grateful for everyone who joined today and for those who are continuing to work to lift up Adriana's family and to make sure that the other Black parents and mothers in the state of Georgia don't have to experience this type of horrific tragedy.
Thank you so much, Ashley. And next, and as our final speaker, we're going to hear from Aleo Pugh, Georgia Communications and Cultural Strategies Manager with URGE, Unite for Reproductive and Gender Equity, and also the Communications Chair of the Reproductive Freedom Act campaign, which many of our organizations take part in and just convened under the Amplify umbrella. Aleo, go ahead.
Good afternoon, everyone. Today we're rallying around Adriana Smith, a Black woman, a mother, a registered nurse, and importantly, a valued community member who should still be with us today. My colleagues have already outlined how chilling it is to see yet another Black woman whose attempts to advocate for herself were ultimately dismissed and whose life was cut short as a result. As of now, her body is being kept on life support in an attempt to sustain her pregnancy, an unusual interpretation of Georgia's 6-week abortion ban. But I also want to be clear, just because HB 481 doesn't explicitly mandate these devastating outcomes does not mean that anti-abortion politicians can wash their hands of responsibility. Adriana Smith's death is not a tragic misreading of the law, it's a direct consequence of it. Abortion bans like HB 481 don't just outlaw care, they intentionally create fear and confusion in moments when urgency and clarity are needed. Providers are made to second guess what care is legal. Pregnant people are left uncertain about what decisions are available to them. And when the law disrupts what should solely be a decision between pregnant people, their families, and healthcare providers, it leads to suffering and death. Adriana's story is heartbreaking, but sadly, it's not an isolated tragedy. And so I also want to speak the names of Amber Nicole Thurman and Candy Miller into this space. They were also 2 Black women in Georgia who died preventable deaths because of denied and/or delayed pregnancy care. If we extract Adriana Smith's death from this larger pattern, we miss a critical truth, that these are the predictable consequences of abortion bans that systematically deny people, especially Black, poor, and rural Georgians, dignified, life-saving care. And that's why we need bold policy change. That's why we need the Reproductive Freedom Act. The Reproductive Freedom Act would help ameliorate the restrictive, dangerous, and undignified conditions in Georgia that already have and will continue to cost lives by repealing, enshrining, and expanding abortion access. The RFA repeals the medically unnecessary restrictions that harm us, including the state's 6 and 22-week bans. It would also repeal fetal personhood laws, mandatory waiting periods, and end the requirement that only physicians can provide abortions. Importantly, the RFA is also proactive, enshrining our rights to make our own reproductive decisions without government interference, so that every pregnant Georgian can decide whether to continue or terminate their pregnancy. And it doesn't stop there either. The RFA also expands real access to abortion care by ensuring that young people can get the care that they need, as well as extending insurance coverage for abortion. Our laws should protect our rights, not try to control and dehumanize us. Adriana Smith deserved better, and we all do. So we, as the Amplify Georgia Collaborative and the campaign, are calling on Georgia lawmakers to do what is right, what is just, and what is long overdue. Pass the Reproductive Freedom Act. Return the power of pregnancy decisions back to where it belongs. So if you're listening with us today and you're wondering how you can get involved, you can actually take action right now. Send a letter to your Georgia state legislators urging them to pass the RFA, and we'll provide those links after the conference. Several organizations are also planning upcoming events and actions to honor Adriana and her family, and also to provide resources to our communities here in Georgia. So this next Tuesday, May 27th, Black Voters Matter and a coalition of organizations and advocates or organizing press conferences and direct actions across the state. On Saturday, May 31st, Sister Song is organizing a Trust Black Women collective altar build in honor of Adriana Smith from 2 to 4 p.m. ARC Southeast and other RJ partners are organizing a community town hall in the coming weeks to provide support and resources to community members. And again, Amplify Georgia will email all attendees with sign-up links for these events. And you can find more information and developments on Amplify Georgia's Instagram page at AmplifyGA. Thank you so much for being with us today, and I'll turn it over to Rula for questions.
Thank you so much to all of our speakers. We really appreciate all that you are doing with us and in your organizations, and your point of view here is essential. As a reminder, if you registered, we will be following up with you about actions to support, to call for change. And panelists, instead of typing an answer, we are going to call those out live. So I see first a question here in the Q&A. Is anyone in contact with the family? How do they want the public to move forward? Danielle, with Sister Song, would you like to respond to that?
Yes. So there has been some outreach to tap into the family, but we have not been able to get in contact with them yet. They're dealing with a lot right now, so it's understandable. But we have informed them of who we are, and we would like to take their lead on next steps on how we move forward. Thank you.
I think we can also say that this moment as a moment for press to help elevate the message. We really are especially prioritizing the support that they need, the information that they need, and that they know they can reach out if that would be helpful to them. And certainly actions we hope are going to be supportive for them. I see another question in the registration questions. Let's see. Ashley asked from registration, what actions can be taken by community members and specifically by birth workers? What kind of training would be most helpful? I think we talked about community members just now, and we'll update you. Does anyone want to speak to actions and training where birth workers are really well situated?
Yes, I can jump in. Again, so Sister Song has the Birth Justice Care Fund, and we coordinate with birth workers and support them in their political advocacy, the work that they do, taking care of families, offering childcare at times. So we are definitely advocates for birth workers. So if you're interested in joining forces and joining the Birth Justice Care Fund, you can tap into sistersong.net and you'll see the information there.
Thank you so much. We have a few more questions. Question from registration. What are the best next steps for other organizations regarding mobilization? I think many organizations are following in a very similar path to what Sister Song, what Sister Song is doing, that Danielle mentioned, that many of our organizations are doing, prioritizing that we want to support the family and certainly not put them in harm's way, and knowing that we need to meet the needs of our community no matter what. Information and resources will always be needed in a time like this. And so you all who are in organizations out there, if you are following those steps, and especially if you're letting us know about them so that we could work together, I think that that is exactly what we are trying to do, and any organization that's allied can do. I want to move us forward to the last two questions. Okay, how can folks who are not in Georgia support? I'd like to invite, you all can let me know. I'd like to invite Pregnancy Justice to comment on this. How can folks who are not in the state support? I know, yeah, from a national perspective, how do cross-state support moments work?
Yes. So Georgia, unfortunately, is not the only state that has laws that, for example, override advanced directives, and I know that wasn't applicable in this situation, but the whole framework of fetal personhood, the idea that a birthing person loses their rights when they become pregnant, is rampant and exists in laws across the country. And so, depending on what state you're in, there might be some advocacy and organizing happening to challenge those laws and also to challenge the way that fetal personhood shows up through things like pregnancy criminalization. So, people who are navigating substance use, losing their children or facing criminal charges based upon their birth outcome. That's probably happening in the state that you're in. And so thinking about, of course, you can follow pregnancy justice and find out more ways about to get involved in your specific state. And from a national standpoint, from a federal standpoint, there are opportunities for all of us to be challenging lawmakers to prevent them from trying to embed this framework, even though some lawmakers are calling it equal protection and stealing for a framework that should have been applied to the dignity of Black people and applying that framework to fetuses and embryos at the federal level. Please stay aware of that and follow us to learn more about opportunities to challenge when those bills come up, and they are coming up right now. And obviously, we're thinking about Adriana today, but there are unfortunately so many people, hundreds of people, unfortunately, who were facing criminal charges based on their birth outcomes through this same type of legal framework that brought us here today.
Thank you for that. I'm going to see if we can get 1 to 2 more questions answered. And Dr. Zoe, I think wanted to add on to what Ashley just said. Please go ahead.
Thanks, Rula. I'll also offer for individuals who are outside of Georgia and outside of the South who are learning about these issues maybe for the first time or haven't considered reproductive health policy in the South since the Dobbs decision, that now is a great time to mobilize with your pockets and with your material resources to local abortion clinics and local reproductive health clinics who provide comprehensive care for folks throughout their reproductive lives. To also do so for local abortion funds and other material support organizations, many of whom are on the call. Big shout out to ARC Southeast, who is our local abortion fund who supports people across the South, not just in Georgia. And again, to make waves with local policy members, talk to your family members, talk to your community members, amplify these stories, make sure that you're not the only person in your community who has heard about Adriana Smith, who has heard about Amber Thurman, who has heard about Candy Miller, who has heard about the abortion bans that we're facing here. Our opposition banks on us being quiet and siloed and disconnected. So let's make sure to do the opposite of those things.
Thank you so much for that. I think we're going to have 1 more question, and I think I'll comment on it and invite an additional organization or 2 to they have an additional thought there. In her most recent interview on Monday, Adriana's mom said she wanted to be clear about the circumstances of what the family wants. There is a date scheduled for a C-section. It seems as though she's walking back her initial comments of being in this position because of the abortion law. How will that affect the RJ community's response? That's like a multi-barreled question, and this is one reason that we've continued trying to make sure that we comment only on what we know to be true. Also, that we've been concerned that there have been news stories that really flatten or jump to a conclusion about what it was the hospital said or what it was that the law means. We're not sure which. And so we are clear HB 481 does not mandate the outcome, the situation that we're in. And yet it also is responsible for a lot of the confusion that consistently ratchets up the amount of ratchets up the barriers for all Georgians who are pregnant and may need any kind of care during pregnancy. That confusion comes up every time, even when the law itself has not mandated a situation is happening. And so what I think Pregnancy Justice has commented on before very beautifully is that Georgians, everyone, along with their families, needs to be able to make those decisions with dignity and free from government intrusion. And that these situations can be really complex and much more complex than an abortion restriction usually accounts for. That these restrictions are not ever going to meet the complexities of mourning or losing a loved one or of facing a complicated medical situation, and they shouldn't try. We need to not have these restrictions taking the place of people's ability to know that they have room for choices and decisions with dignity. So I think, just speaking as one member of the reproductive justice community, the right to give birth, the right to not give birth, the right to parent the families that you choose to have and the children that you have in an environment that is free from violence, those are all part of what we do regardless. And I welcome Danielle at Sister Song to jump in now. And thank you very much.
Thank you for framing the reproductive justice framework, because reproductive justice is about this too. RJ holds space for complex truths, for grief, for shifting desires, for honoring both life and loss. We're not here to police decisions. We're here to fight for people to have the power to make them. So what we are demanding is that families like Adriana's be trusted and supported every step of the way, that no one is forced to endure trauma because the state has more power than love. I feel that every decision, whether it's to continue pregnancy or not, should be made with dignity and not under duress.
Thank you. I think we can have one more of our speakers comment, and then we will wrap up for you all. Dr. Zoe wanted to add one more thing here. Go ahead.
Yeah, I also wanted to add, I think it's really crucial to remember that Adriana's death was likely a preventable one, and that her family shouldn't even be in this situation. That healthcare providers shouldn't be, you know, I think it's really crucial for us to remember that even if we put HB 481 to the side, prior to the Dobbs decision, the fall of Roe versus Wade, we were already dealing with a Black maternal health crisis in Georgia. We were already dealing with criminalized pregnancies based on other policies within our state. We were already dealing with Black women and Black birthing people not being trusted, believed, respected, and truly cared for. So while it's important to put focus on the way that abortion restrictions further endanger our communities were already in danger. And I think that that's a really important point to uplift. I hope that people are able to zoom out a bit, like Danny said, hold multiple truths at one time, and recognize that regardless of our abortion policy in Georgia, our communities are still under threat, given the current state of the medical industrial complex, our healthcare systems, and our state policies in Georgia.
Thank you so much for lifting that up and bringing it back to that fundamental reality. So I think we are going to wrap up. As a reminder, we will follow up with an email letting you know about updates in direct actions and calls to action, and how to learn more about the Reproductive Freedom Act, as well as the community actions coming up. Before we go, we want to remind you that, first of all, if you would like members of the media, if you'd like to follow up with more questions or speak further with one of our speakers, please reach out to media@amplify-ga.org and we can connect you. And before we go, we also want to remind you that the Reproductive Freedom Act needs the backing of a majority of our state legislators. If it had that, we would not be in this situation right now, and yet it is an issue that has not been treated with the urgency that it deserves by that majority. So the call to action that we have for community members today is to contact your state legislators, and you can go to amplify-ga.org/RFA to read more and see what action steps are available to you, including contacting your legislator with the tools that we have and getting a lot more of the information. I think that is everything that we have. And we're going to start signing off. Tech support, let me know if we need to say or do anything else. Thank you.
Recording stopped.